It's not unusual to see dogs roaming around the hospital. Pet therapy is very popular here at Children's Medical Center, but one place you don't see it is here on the surgery floor.
We were really concerned. We had a lot of discussions about whether or not we could do this and what it meant, and we just decided that we were going to give it a go and see what happened.
What happened was an instant boost in morale on the surgery floor. Kids facing surgery, whether it was routine or serious, quickly forgot their fears when a furry face enters the room.
It makes me happy.
Well, we think it's a great program. It makes her very happy to see the dogs. It makes her more comfortable, and we just really enjoy seeing it.
Nino is a regular visitor to the surgery floor. The 3-year-old lab mix is well known for his variety of costumes and the father-daughter team that brings him to visit.
He loves for people to be able to come up to him, lay on him, roll on him. Children tend to come over and just lay their whole bodies across him.
Basically, he loves people, and we have a hard time getting from the main door of the hospital into the surgery unit because he wants to meet and greet everybody.
Nino adapted quickly from a mutt that was found on the streets to a loving companion who doesn't seem to know a stranger.
Sometimes there's a person in the room that isn't the patient, but it's maybe a mom or a sibling, and they really need the attention more than the patient does, and then they'll tell us later that that was the best thing, that they needed it. A lot of times parents need just some tension relief because they're so worried about their child having a surgery.
As it turns out, it's not just the patients and their parents who enjoy Nino's weekly visits.
It's just unusual that a day would go by that we visit that a staff member doesn't get down on the floor and say, I was looking forward to Tuesday because I knew I was going to get a kiss from Nino.
In most cases, it takes medicine to heal a sick child, but sometimes a wet nose and a wagging tail can be just what the doctor ordered.
You know, the parents are frazzled, the child is hysterical, and he comes in and it's all of a sudden zoning in on the dog. They've forgotten what's going on. The doctors can come in and they do all their vitals while they're playing with the dog, and it's amazing because then when we leave, it's a completely different child.
I think you put him to sleep.